In your neonatal unit or on labor ward, there should be a trolley dedicated to neonatal resuscitation. So no equipment should be here which is not used for neonates. I've divided this in a section for respiration. The next session is on fluid resuscitation or metabolic resuscitation, and then we have some drugs. Let's start with the airways. In here you see we have a laryngoscope with different types of blades. We have the straight blades, Miller, this is size 0, this is size 0,0, then we have size 1. But size 1 is basically too big for a baby, so it should not be on a neonatal resuscitation trolley, to be honest. So we'll move this one out. The same goes for the curved blade. When you look at the section on intubation, you remember that we have to depress the tongue. And this curve makes the depression more difficult. So I would advise not to have this on a neonatal resuscitation trolley. So we have the laryngoscope with blades. We have the light is working. We should have spare batteries. If we go to intubate, we need suction, we need the magill forceps, and we have different types of tubes. Size 2.5, size 3.0, 3.5. Of course, we have our bag and mask, which has been demonstrated. It works, air pops out. We have nasal cannula to supply oxygen. We have oral airways for alternative airways, but as you can see, the orange one and the white one are too big for babies. So really should not be in a neonatal resuscitation trolley. So I put them aside. This piece of wire is a guide wire, which can be used for oral intubation. You shift it into the tube. Make sure it doesn't come out at this end, because then it might damage the mucosa of the baby, and this way you can safely intubate the baby orally. I did not mention the magill forceps, which we use to insert the endotracheal tube. And then there is the scissors and strapping for securing the tube. So this is for the airway. Then we move over to the fluid resuscitation. We have gel coats to insert the drip. We have drip sets. Of course, the drip set should be the same which is present in your hospital. And then whatever comes to it, it depends on what in your hospital is the equipment available. If you don't have infusion controllers, we urge you to use a controller such as a dialer flow. Although not very precise, it is some kind of regulation of the flow, and an unregulated drip is very dangerous. For that one, we also can use a buratol. So we have a certain amount of fluid we want to insert in a certain amount of time, and we know that the influx will not be more than we have set on this buratol. There is normal saline, in case we need to give the baby a fluid bolus. We have neonatal light, which consists of glucose 10%. If we're not able to insert a peripheral drip, we have a umbilical catheter, which is in this cannula. It's very thin, you can see. And we leave it in here. If it's not available, we can use a nasogastric tube. To secure that one, again, then we need the strapping and the scissors. In case it is a umbilical catheter, we might need a stitch to secure it and a tegaderm to cover the umbilicus. So this is the fluid resuscitation section. Now we have drugs. There should be available the adrenalin and the naloxone. In order to dilute the adrenaline, we have water for dilution, we have a syringe, we have needles, and this makes this set complete. And then we have a glucose meter to check for glucose. So basically, this is what should be on your resuscitation trolley. It should be checked each day to know that everything is there, and after each resuscitation where things have been used, the trolley has to be checked again.